Our research is multifaceted and it uses the many specialist facilities that we have at the Pirbright Institute that are unique and world-leading. We have a capability amongst our people with specialist knowledge and skills that are equipped to do this research at the cutting edge and provide critical and fast answers.
The main area of our research is to investigate how avian influenza viruses emerge in wild bird and then transmit from wild bird to poultry and then cause disease. And then we develop vaccines and diagnostics to control these viruses. We are studying how these viruses bind to the cells and to enter it and cause disease, and then how the new vaccines can protect and how the new diagnostic can detect the disease.
I'm part of a UK-wide H5N1 consortium, or several consortia actually, called the Flu Trail Map and the Flu Trail Map 1 Health Consortia. These focus on H5N1 in birds and mammals. Of course, this bovine outbreak has been of great interest to us. We are currently working on risk assessing H5N1, both in bovine hosts, in avian hosts, and in humans, of course, because H5N1 is one of these viruses that we think could have some pandemic potential. We've seen H5N1 in a number of species that haven't traditionally been found to be infected. Most concerningly, mammalian species. So there's been some fairly good evidence of mammal-to-mammal transmission in species like mink, at fur farms, in sea lions and seals in South America, and as well as this most recently and potentially most concerningly in cattle across the USA, specifically dairy cattle. There's lots of questions that we want to try and answer. Things like, how is the virus spreading between different farms? There's some evidence this may be through movement of infected cattle, but also how is this virus spreading within farms? Evidence so far suggests that this is spreading through contaminated milking machinery rather than through a more natural route like respiratory transmission. But that doesn't mean the virus might not evolve over the next few months to spread this way. So all these are questions that we're trying to address here at Pirbright.
So fundamentally, our science has global impact and reach. We do that through working in partnership with other like-minded organisations, both nationally and internationally, to develop really robust science that can be used by policymakers and governments and industry operatives alike to try and get better control of this disease.